Hello, everybody. Thanks for joining us this evening, and thank you, Linda and uh, LDN Research Trust for hosting this great event with us. And yeah, we're. My name is Masoud Rashidi, as as Linda said, and I'm with Anna Rashidi. She is my wife, and we started in compounding pharmacy back in 2007 in Folsom. We've been here, but we actually excited because we had our anniversary of 15 years for the pharmacy last month. It was very exciting, and we had a big milestone, and we're keep going. And tonight, I'm going to talk to you a little bit about LDN, a little bit of history, and what mostly a little bit on like some of the stuff as what we do as far as compounding and what we do as a compounders. I'll talk about that a little bit too. I'm gonna go ahead here and share my screen. So, okay. So everybody is screen out there, should be out there. So today we're gonna talk about low-dose Naltrexone. As I said, we're innovative compounding pharmacy in Folsom, California. We do compound and specialize in making special medications for both pets and human. And then we do ship anywhere in California. We do kind of send medication all over to state of California. We do serve a lot of local patients with local doctors around us, and we're really excited about having this event tonight. And I'm going to get started. So this is, of course, ourselves. It's in our background is one of our labs that we make the medications here, and we are very proud of our lab that we made very state of the art. And then we are one of the compounding pharmacies that we are accredited for the compounding. It's not a requirement, but we did that just to make sure that we do go above and beyond. Myself and my wife, actually, we met at pharmacy school and got married, we have 2 kids, and started the pharmacy a few years after we started, we graduated. We both worked for a chain, like at that time it was Long's Drugs. And eventually CVS bought them, and for a few years that we worked, we decided that this community needs something like a compounding pharmacy, and there was none, and we wanted to make sure people have access to personalized medications. That's what we do here. We make everything from scratch for both human and animals, and we do a lot of different dosing that I will talk about in a little bit. Just a little bit about history of LDN. I'm going to talk a little bit about LDN and then go on other stuff. It has been around for a long time. The actual Naltrexone has been around for almost about 60 years. It was synthesized in 1963, patented in 1967, as you see. And then first FDA approval was for heroin addiction and that's a 50 milligram dose, which is still available as 50 milligram. That's the dose that was approved by FDA back in '84. And there's several studies. Actually, in 1991, Yale did study for alcoholism, and it had twice as successful as placebo. It was compared to the placebo for alcoholism. That's why that led to FDA approval with the drug manufacturer for alcoholism as well in 1995. We've had other stuff that come in, like the injectable, and then in 2005, Yale studied obesity, and that's where Contrave came along. Contrave is actually, we are not here to talk about like weight loss for LDN, but I'm trying to say that there are, and that's like about 16 milligram of low dose. It's still kind of low dose, but it's not really low dose that we use. So it's still their drug. The reason I'm bringing up this just to let you know that there are actually medication FDA approved very close to what we're doing. And this drug has been around with really high, long history of it. And then also it's an orphan drug for autism and has FDA approval as well too. And as far as the low dose naltrexone, the dose is anywhere from 0.5 to 4.5. That was when Dr. Bihari actually did it from 1.5 to 4.5. And that's when Dr. Bihari, actually a Harvard physician in 1985, started this for treatment of AIDS patients. Dr. Bihari, actually, that's his picture right here that you can see. He's a very well-known doctor. At the time that he started this, he's very, I mean, triple board certified. He's been very well-known, and as a Harvard doctor, was very well respected as well too. So he did what he found out, that AIDS patients have actually 20% normal endorphin levels compared to a healthy patient that's not AIDS patient. And what they discovered, 1% of normal dose had paradoxical effect. Like it had 300% increase in endorphin levels, which is amazing if you think about any drug that 1% of it would do anything good. I mean, if you just think about like morphine or penicillin or something, if you give it 1% of penicillin to someone, probably it's not going to do anything. If they have severe infection, it might even kill them because you're not treating anything. Or morphine, probably 1% of the regular dose is not going to get anybody any pain relief. So, but this had very good response, actually, and especially with the increased endorphin, people felt better when they take it. They uplifted their feeling, and they were doing much better with that. And he had the best success rate in the country with this low-dose naltrexone. And also in 2007, there was the first LDN research article, which was Crohn's disease, that came out from Penn State. Fibromyalgia, it's been around. I mean, people have been using low-dose naltrexone for a long time based on this Stanford study of fibromyalgia in 2009. You know, a few years ago, we didn't have much articles or publication, but now it's about 850. I think now it's over 900 LDN articles on PubMed, which is really amazing how many publications are there and how many research are being done on this particular low-dose naltrexone, just because they've seen so many good results from it. So it's been amazing how it's been working for patient. And if you ever interested, if you ever Google Dr. Bihari or go to YouTube, he has an interview. There's an interview with Dr. Bihari, which is really interesting. He will tell a little bit about himself and how he did all this studies and how he found out about LDN. And it's amazing. Just research it, you find it. It's really interesting video to watch. And then, as I said, you know, last 5 years has been really, LDN has been expanding very rapidly. And we got a lot more understanding of LDN, what LDN does, the success of the treatment. And it's just a lot of unrelated disease states. Because it has a lot of different multiple mechanism of action. It's been amazing how you see, like when we get this prescription for a patient takes it for, I don't know, rheumatoid arthritis or something, and then the next week they come in and it's like, oh my God, I feel much better. My anxiety is gone, or my pain in my joint is gone. It's just amazing how one thing led to other, and people feel a lot more better for other stuff that has been happening for them too. And then the proper dosing, I mean, one of the very important part of low-dose naltrexone for it to work for what you want to work, you just want to make sure that it has the right dosing. I mean, the original dosing titration was from 1.5, you take it for 2 weeks, then it goes to 3 milligram, and then 4.5. And that was used for many years. Still, a lot of physicians use that. The only problem with that is sometimes that dose doesn't work for patient. Patient needs to start somewhere lower, or they have to go a little bit higher. And that has been really interesting when we see how one patient can get a lot more benefits from dose changes. In our practice at the pharmacy, we see about like 3 to 4 dose changes until a real good response happens. And not for everybody. For some people, 1.5 or 4.5 works really well. But it's really important if you see a physician or if you're working with your pharmacist, work with someone that they know about those things, those changes, and they're committed to work with you to find your sweet spot, because you want to know your sweet dose for LDN. It's really important. It works differently for everybody. Everybody needs different dosing. So be really mindful of that. If you have taken it even in the past and didn't work, call us, or we can look into it and see why didn't it work, or where you may be on too high of a dose or too low of a dose, and that makes a lot of difference. I've had several patients that they came to us and said, I've had it for several years and it hasn't done anything. And then when we give it like a 2 weeks break, we say, okay, let's start all over. And we start them on lower doses and we go up, and sometimes they'll, instead of 4.5, they stick at 3 and say 3 milligram work for them, great. So we just really, is very important to know the dose. The expanded dosing range I have here is from 1 microgram to 8 milligram. And that's one of the reasons we separate us from a lot of compounding pharmacies, that they only do few doses, but we do anywhere from 1 microgram. I mean, 8 milligram is, maybe we go up sometimes at 9 milligram, depending on what the patient needs. But usually we don't want to go really higher than that, just as a low dose. Sometimes we split the dose few days. And the 1 microgram, you may ask, what is this for? Or why is this such a low dose? Does it do anything? Yeah, most of the time we use the microgram dosing for patients that they are opioid, they're on opiates, or they have taken a lot of opiates, or they're taking either oxycodone or Norco or hydrocodone or any of those. And what we have seen, actually, a lot of times when you put them on very ultra low dose naltrexone, they feel better. Their pain manages better due to the way that reacts with the receptors that in the body. So they, most of the time we hear, oh, my pain is better, it's getting better, I feel better. And eventually, at some point, we see they actually don't need as much Norco or oxycodone or any of the opiates. So they reduce the opiate as this goes up. So we kind of, sometimes we have this phenomenon that as you increase the microgram dosing, you would reduce the opiates. And it has been working really well, and people have had really good success with it as well too. And then this is something that, again, I can't emphasize enough, that's customized dosing to both disease state, condition, and the individual patient. So it's really important for what disease, what you're using, it's really important. Like, one of the things that we recently found out is, like, for Hashimoto's patients, a lot of times when you go over 3 milligram, a lot of times you see the antibodies start going up again. So a lot of what we have found out, about 2.5, 3 milligram works really good for a lot of Hashimoto's patients, and it reduces and keeps the antibodies low. But of course, for some patients, still the 4.5 works, but majority of them, what we've seen, talking to practitioners and looking at labs, we found out like about 2.5 or 3 milligram is where you want to kind of be with Hashimoto's. And kind of couple of studies. This is a really good review of LDN, if you will. It's really important if you're practitioner or patient, it's a really good article, paper to read, because it has a lot of different literature review from 1980 to 2018, and it reviewed over 900 published articles, and it summarizes its top 85 articles relating to LDN use for chronic pain conditions like fibromyalgia, CRPS, neuropathies, joint pain, opiate tapers, mental health, ultradose naltrexone. So it kind of looked at a lot of different dosing and different mechanism of action that this drug can have, and they picked the best one and kind of with the most information on there and put it there. It's anytime I talk to a physician or a practitioner, I always give them this articles like, please read this. It gives you a lot of information why LDN is important. There are like dosing charts in there as far as like the standard dose, which is 50 to 100 milligram opiate receptor antagonist. That's how as a mechanism it works. And then as we mentioned earlier, it's for alcohol and opioid abuse. Low dose, it goes from 1 to 5, mostly, as I mentioned again earlier, for CRPS and multiple sclerosis, Crohn's disease. That's what we've been using a lot, Haley, and things like that. And very low dose, it goes from 1 microgram to 1 milligram. With about 1 milligram, but ultra low dose is less, like about less than 1/1000th of a milligram, almost 1 microgram, and goes up from there. And potential opioid analgesia as well too. The primary, and this is like again another table in the study summary of clinical experience on low dose naltrexone. And that one is for MS. And it's a peer-reviewed literature, and they talk about what doses and what would be the best to use at that time. We also, again, another summary, and this one is Crohn's disease, peer-reviewed, different dosing. I'm not going to go too much about it. I just want to let you know that there are a lot of studies out there with very good information out there. As far as the chronic pain, Stanford Medical School had some finding the use of low-dose naltrexone as a novel anti-inflammatory treatment of chronic pain. One thing that a lot of times we miss, it's a really great overall anti-inflammatory. We have seen very good result as an reduced inflammation, course pain, and things like that for low-dose naltrexone. The mechanism of action effectiveness is in treating chronic pain condition. That's what the finding was on this. And then LDN represent a promising new treatment approach for chronic pain condition through thought to involve inflammatory processes. So a lot of our pain is from inflammation, and a lot of us as American are inflamed all the time because we eat inflammatory foods. We don't look at what we sometimes put in our body. A lot of drugs causes inflammation. So this is a really good medication overall as a low dose naltrexone we've seen to reduce the inflammation overall. And then as far as the opioid withdrawals, that's what we were talking about. There was double-blinded randomized opioid detoxification trial of 127 opioid-dependent patients that undergone 6-day methadone taper and an LDN of 0.125 milligram to 0.25. Significant reduction in signs and symptoms of opioid withdrawals as measured via the subjective opioid withdrawal scale and the objective opioid withdrawal scale, which is really interesting how this works so well. And that's how we are now using it for opioid addiction. And one thing I want to let you know, I know Linda spoke earlier, and she's a great resource for the whole all of these on her website, which is Low Dose Naltrexone LDN Research Trust. I really encourage you to go to that website if you have never been and look around. There's so many good stuff in there, articles, there are videos, there's a documentary actually I've seen, and that's like on opioid addiction. They did interviews with few doctors, and it's been great. It has a lot of good information. There are patients in there, real patient, that they had such a good result with ultra low dose naltrexone, and they eventually went to low dose naltrexone, and they're feeling much better now. So it's amazing how it works. It's just make sure if your doctor doesn't know, let us know. We can help with the dosing with them and get things going. And then another one, again, ultra low dose naltrexone, oral naltrexone to improve opioid analgesia. Double-blinded randomized trial of 360 with low back pain being treated with oxycodone. Adding 2 micrograms of naltrexone showed significant fewer opioid-related adverse effects such as constipation, somnolence, pruritus, as well as 12% reduction in daily opioid consumption. That's really important. 12%, some people take a lot of opioids, and 12%, it really, for just 2 micrograms of naltrexone, it's a win-win. I mean, you get a lot better cognitive function, the memory works better, clear head, so it's been working really well. And this one, I'm just going to talk a little bit quick about this. It's really, this one actually very good article about depression and anxiety that Harvard Medical School did. It was small patient, but a lot of these studies are small patient population because this is not a FDA drug or drug manufacturer that they have millions of dollars to spend on this. But this one, it showed like 1 milligram of LDN twice a day, substantial and rapid improvement in depression score, which right now what we have seen actually, when you start a patient on low dose naltrexone, they're like, oh, I felt better at the beginning, so I don't know why am I not feeling as good anymore as far as like feeling better. So we found out that when you look at this article, it's because that 1 milligram, it works actually better for uplifting your mood and feeling better and depression compared to 3 or 4 milligrams. So it's, and this one was a twice a day dosing. And one of the reasons we do twice a day dosing sometimes on this, because the half-life of naltrexone itself is not that long, so it doesn't last in your body. Although what it does, it lasts about 7-8 hours in your body, but then when it increases your endorphin lasts about 19 hours in your body, that increased endorphin. So when you take the second dose, it takes you to whole 24 hours and it gives you. So what we have found out now, we do a lot of what we call it hybrid dosing, we have, okay, somebody has chronic pain, 1 milligram twice a day is not going to help them. So we get them to maybe 4.5 or 6, whatever they have at nighttime, and we just add a 1 milligram dosing in the morning, and that helps them with the anxiety, the depression, feeling better, fatigue or chronic fatigue. So that has helped a lot of people with the twice hybrid dosing. Of course, we do twice a day dosing for a lot of pain management as well too, that we've seen really good results. So it's really good. And they actually kind of compared it to SSRIs as well too. So it showed more benefit because it works quicker than, let's say, Prozac and things like that. And then it brings us to these 2 questions that everybody asks, like, how can one medication be such an effective treatment option for so many different diseases and conditions? We get this question all the time. I mean, and the second one is, why do we need to learn about it through seminars such as this, or versus traditional mainstream medical pharmaceutical education? I'm sure some of you know this medication, as I said, it's been around about 50, 60 years now, the actual naltrexone. So it lost its patent. So at this point, drug companies, if they want to repatent it, it's not worth it for them. So it's just like not a lot of money, or, you know, they can't repatent it because it's been there, lost the patent. Although there's right now, one drug company is trying to do low dose naltrexone for for pain, and we're seeing where it goes. I think it's on the second phase. And the other reason is because it wasn't in a drug manufacturer or FDA approved for these conditions, it's not taught on medical school or pharmacy school. I myself learned about it when I started compounding. I had no idea what it is when I was in pharmacy school. We knew what naltrexone is, and that brings me and the reason we learn about it and the reason we are doing this just to make sure everybody knows about it, learn about it, and hopefully somebody benefits from it. There's a lot of good benefit from this. And they always ask me, people always ask, who do I see for this medication? Uh, integrative medicine doctors, functional medicine, which we have doctors here tonight that they're going to talk, naturopathic medicine. They're Dr. Saure is very well functional medicine and integrative. Dr. Mathewson does as well, and she's a naturopath as well. Some chronic pain doctor, they do low-dose naltrexone as well, family practice. And one thing is we talk with a lot of our patients, just talk to your doctor. If they need information, we go and talk to them. We bring them education, we bring them all the articles and studies that are there to show the benefits. And we get actually a lot more patient from here, go talk to their provider, and then we get a prescription for them a couple of days later because the doctor is interested or they've heard, but they have no help, and we help them with the dosing and all that. These are some of the compounded option I wanted to talk very quickly on it. It just the one on the left, as you see, these are, we call it mini troches or lozenges. These are dissolvable, so it helps if you do have especially GI issues that some people, when they take the capsule, they have some GI issues. So this one goes under the tongue and bypasses the stomach, and we can make it in any doses on this, which these are really small. We can flavor them. The one on the right, these are troches as well, or lozenges. But this one, if you look, I don't know if you can see it very well, but it does have scoring on the back. So it can be cut in 4 pieces. So let's say a doctor calls a 6 milligram, you can do 1.5, 1/4 of it, and go to 3 milligram, take 2/4 or 3/4, or all the way to 6 milligrams. So that one also is helps with the GI, and it get a better absorption because it bypasses the stomach and liver, and you get very good. With this bigger one, you can cut them. Small one, not really. Just we make the final dose on those, but these ones are like when you're titrating up, works really well. Of course, we can make suspension in both oil or water soluble. The cream, a lot of times we use, these are topical transdermal creams. So we do it in we put it in a base that it actually transdermally goes through the skin and works really well. A lot of time we use this for autistic kids because they don't want to take anything oral, or they just, they don't like medication. And this, sometimes parents put it at nighttime right before sleep, and this one is on top of this hand, but usually we recommend to put it inside the wrist. It's a very thin skin, goes in. Capsule, of course, it's the most commonly used one. We only use a very little amount of these capsules are pictures, but we usually use clear capsules, no dyes in there, just to make it clean. This one is just more visible. That's why I picked this picture, but we do them all with no filler, or, with filler, but it's microcrystalline, or you can choose your filler. Some people want different fillers in there, and we're happy. That's why we're compounding pharmacy. We make everything customized. So you tell us, as long as it's legal, we'll put it in there. Okay, and then very quickly, we do always, of course, work with your physician or provider. We call this a triad between patient, pharmacist, and physician. We work with them. We always have their blessing for any prescription, of course. We want to be them. One of the things we do for the providers is this LDN prescription guidance, kind of tell them for different dosing, what dosing they need to do for different disease state, or if it's a titration, initial titration or combination, like for thyroid disorder, start dose for autoimmune, chronic pain. So that has helped a lot of physicians because they just don't have a lot of time to go and do a lot of research on this. So we help them with the dosing. We have collaborated with a lot of doctors to help them, and then also we do educate them as well too, as patient, like same thing. We do have this kind of educational stuff that has a lot of different disease states on there, and what LDN is. Most doctors love this. Very quickly, I want to let you know the LDN book. The first book was great. The second book is even better. I just talked to Linda. I think the third book is coming. I don't know if it's supposed to be a surprise. Hopefully I didn't burst anything, but it's going to be around October or something that the third book is coming. It's even more comprehensive. If you haven't read these books, please go get them, buy it. We do have it at the pharmacy. We sell it as at cost. We don't make any money on this just because we want to make sure people get more education, and doctors, we be happy if it's a local doctor will drop one for their office to just make sure we can help one more patient. That's our goal with all these seminars and things like that, just to make more education. I'm not going to go through this. I mean, these are just all the condition lists. I just want to let you know how many, so many different conditions that there are. The Haley disease, really the dermatological painful disease, and psoriasis is really big. If you have psoriasis or rheumatoid arthritis or anything like that, it really works really well. Please call us, talk to us. I've had so many good results with psoriasis and arthritis and pain in general. Lyme disease, of course, and a lot of times we use it for breast cancer. I know Dr. Matthewson's going to probably talk about that because she's specializing in oncology as well too. Multiple sclerosis, MS is huge. I know great people, great patients we've had that very good success. Actually, we started LDN back in 2008 because of a patient who came in, and we just opened. It was not even a year. It was my wife, myself, and we only had a technician. We were not big at that time. We're just starting. He came in, and pretty much he came in with the wheelchair, said, okay, you have something on your window, says, I'm your problem solver, solve my problem. I have MS, I'm on wheelchair, been on this for a few years, I've taken all this medication, what can you do? I'm like, give me all your medication. I really didn't know at that time about LDN much. I maybe briefly heard of it, but I did some research. I called a company called PCCA, which we do a lot of our chemicals, very great company. They have clinical pharmacists and consultants, so they told us to start this patient on low-dose naltrexone. We kind of did 1.5, 3, and we did it actually at that time, and that was our first ever LDN, and once it won 2008. 3 months later, he was getting refills, of course, getting it, and then 3 months later, I saw him walking to the door. I'm like, wow, what happened? He actually was not on a wheelchair. Of course, myself and my wife, we had goosebumps, and we were just like, what's going on? And we talked to him. He was like so excited. It's like, I've had so many drugs, nothing worked, and this has been really a changer. Of course, he walked in, but still had his wheelchair outside and walker. He said, I have to be careful, but he did walk in, talk to us, shook hand, and he's still taken it for many years and works really good for him as well. Pandas, and I'm just going to go through this. I just put this together just to let you know there's so many different condition lists that LDN can help. I know we have other speakers. I don't want to take any of their time. And then very quickly, we do education, patient seminar monthly. We do support groups, small groups, or one-on-one consultation. And also we do provider education as well too. One last thing I'm going to just touch on is LDN for pets. We have done LDN for dogs and I think one cat, and then it works really well. We had one patient who came to one of our seminar pre-pandemic, so it was in our pharmacy, but they heard about it, we talked about it, and she had a dog. The veterinarian gave him 1 month, called the veterinarian, gave him this 1 or 2 study on pets, not much, but we kind of convinced the veterinarian. Veterinarian gave the pet 1 month after the cancer. 8 months later, the mom still comes and cries every time, says, I'm so glad that I came to this seminar and my dog's still alive and is happier as ever. And I'm not giving him anything other than LDN. I don't know. I'm not claiming it's working. It's the LDN or whatever happened, but it's been working really well for her. And because there's not much study, but we've had a lot of colleagues have used it for pets and works really good. And we have used it for several either arthritis or pain, and it's working very well for pets too. And in conclusion, I just want to let you know LDN represents a novel, highly effective treatment option for an increasingly wide array of chronic pain, autoimmune, and cancer for both human and pets.